Healthy women, today we are going to talk about pre-eclampsia. This big word stands for hypertension in pregnancy. Why we call it pre-eclampsia is because this hypertension starts 20 weeks after you get pregnant. And then when it starts, we have it's dangerous in pregnancy and can be life-threatening to both the mother and the baby. The aim of any antenatal care is to have healthy mother and a healthy baby at the end of the pregnancy. So once we have hypertension in pregnancy, this can be life-threatening, and so we have to be conscious, self-conscious. We have to know the preventive measures and what to do when it occurs. What is the cause of hypertension in pregnancy? Well, there have been several theories about the cause, but the major thing is that there's a problem with the placenta. The placenta is that part of the pregnancy that supplies blood from the mother to the baby. Once we have the blood pressure rising up from the second half of pregnancy, we need to take note of the symptoms and signs. Before we go to the symptoms and signs, let's talk about the risk factors. When a woman is obese, that's when you're overweight, or your BMI is above 30 kilograms per meter square. This can be a risk factor. Women who are already pregnant, have hypertension before this current pregnancy, are at risk of having pre-eclampsia. Also, when we have genes, maybe there's a case in your mother or your sister, first-degree relatives that have had hypertension in pregnancies, you could also be at risk for having hypertension in pregnancy. So what are the signs that we'll see when there's hypertension in pregnancy? Take note that once the blood pressure is 140 millimeters of mercury on the systolic and 90 millimeters of mercury at the diastolic, then we say there's hypertension in pregnancy. Once we now do a urine test and there's protein in the urine, then we call it pre-eclampsia. What are the symptoms that we notice? Headache, number one symptoms. Pain in the upper part of the abdomen, we call it epigastric pain, which could also be related to the right side of the upper abdomen. These are signs of pre-eclampsia. Of course, some women can feel dizzy, some women can have fainting spells during pregnancy, and these are signs to note. In pregnancy, naturally, we have leg swellings in pregnancy, but when you notice swellings that are, extreme, swellings that are moving away from the feet, moving towards the leg, and then also moving towards the lower abdomen, this is severe, then this is a sign that I should go to the hospital to complain about it. So those women who put on wedding rings, you notice that your fingers are getting swollen, or the face is getting puffy above what you usually notice in pregnancy, then these are red flags that will point to visit to the healthcare provider. Then we have difficulty in breathing in extreme cases. Of course, we shouldn't wait at home until we have difficulty in breathing and then we fall down suddenly from fainting attack, or we start having convulsion. These are severe forms of hypertension in pregnancy. So please don't let that happen to you before you go to the hospital to complain about headache, blurring of vision, or epigastric pain during pregnancy. And when you get to the hospital, the first thing to be checked is your blood pressure and urine tests to see if you have protein in the urine. And once these are noticed, then of course we have to start planning delivery. I told you pre-eclampsia is because of a problem in the placenta. So of course the ultimate treatment is delivery, because once you deliver the baby, the placenta comes out and magically you see the blood pressure start coming down. So when we want to plan delivery, we decide, is this baby matured enough for delivery, or this baby needs to gain more time? So most babies below 34 weeks of gestational age are premature, and we look at the ultrasound findings of the weight of the baby to see if this baby can survive when you deliver prematurely. Of course, to help the baby after delivery, we usually give the mother what we call corticosteroids, dexamethasone, to help in the long maturity of the baby. And then once this injection is given 2 doses 12 hours apart, we have given the baby more chance of survival outside the womb. Some mild hypertension in pregnancy we manage with antihypertensive drugs. But once we start managing with antihypertensive drugs and it's not responding to the drug, then of course delivery is the best option. Convulsion that occurs with high blood pressure is a severe form, and of course we give drugs to prevent convulsion. Magnesium sulfate is the gold standard drug that is usually administered to the pregnant woman before we consider delivery. And then after delivery, this drug will continue 24 hours after delivery. And of course, the antihypertensives also continue 24 hours after delivery, so that the woman's risk of having severe form of hypertension or convulsion after delivery is also reduced, because this woman is still at risk within 6 weeks of delivery. So don't think delivery is the end of it. We still need to monitor this woman's blood pressure twice a week for the next 6 weeks to make sure that she's free from the complications of pre-eclampsia. So healthy women, you know now about pre-eclampsia. Watch out from your neighbors, your sisters, your aunts that are pregnant. Please always enlighten them about care in pregnancy. Once they notice any adverse reactions, things that are not naturally occurring in that pregnancy, please let's go for observation in the hospital. And of course, primary prevention is antenatal care. Once a woman attends antenatal care in pregnancy, all these parameters will be checked during the antenatal care. And then, of course, prevention is better than cure. So let's stay healthy. Let's keep taking healthy diet. Some of the healthy diets we can take in pregnancy to help prevent hypertension in pregnancy is to avoid salty foods. Let's avoid salty foods. Let's take more fruits and vegetables. Banana, avocado, pear has been known to be very rich in potassium, which will help enrich the blood system and prevent hypertension in pregnancy. Fish liver oil has also been known to help. So when you take a lot of fish, you get omega-3, omega-6 that helps in the good blood supply. And so let's stay healthy. Let's avoid processed meats, white bread, fried foods, all this junk food, fizzy drinks like those drinks that have gas, and take more of water when we are pregnant. Let's take more vegetables, let's take more fruits, and let's stay healthy and keep healthy. Thank you.